Welcome to Uncaged. Today we're speaking with Matthew Taylor. Matthew has been at a lot of the leading medical and healthcare businesses, Kaiser Permanente to Catholic Health Initiatives to Blue Cross Blue Shield to Next Gen Healthcare. We're going to talk about kind of what's the latest in healthcare, where things are going. But before we get into a discussion on that topic, Matthew, tell us a little bit about you and your background.
Yeah, so tis the season, the Christmas lights are up. So that's all done. So I think we're coming in the home stretch. So yeah, my name's Matthew Taylor, and I'm a product executive in healthcare. And like you said, I've worked in a lot of different healthcare organizations, mostly with data analytics and technology, working pretty closely with providers just to figure out how to get them what they need. And so, I tell a story where I originally wanted to go into medicine, and when I was in college, a semester of chemistry and season of getting certified as an EMT kind of cured me of that. I was just like very clear I was not going to be good at the sciences. So for me, it's nice to be able to still work in the medical field and help physicians do what they do with patients and bring the skills that I've been given. So personally, my wife and I will celebrate our 20th anniversary in January, and the three teenagers that we have, if you ask them to describe me, they would say that I'm the dream crusher, because it seems like I'm often saying no to their, requests for various and sundry things. So that's, and kind of home for us is Western New York. So if you think about New York City and go 5 hours west, that's where we are. We're in Western New York.
It's so interesting, that area of New York. New York is actually so large, you forget
Yeah.
sometimes that it extends out that far. But Matthew, I mean, I love your description and, being a dad, I know what you're talking about. But let's talk about healthcare. I
Okay.
mean, healthcare has gone through quite a rapid evolution, I believe, really over the last 4 or 5 years. It was already, I'd say, on an accelerated path before COVID. Then COVID kind of changed the game. And now here we are, kind of this post-pandemic era. Tell me a little bit about what you're seeing out there and how really people are using things like data and analytics to move the field forward.
Yeah. So, like you said, there were a lot of things that were in play, telemedicine, different things in healthcare before COVID. And COVID really just accelerated those things that were in play. And so it started to really change some of the reimbursement conversations, because there were things that physicians couldn't bill for before virtually, that COVID really forced it and said, it sort of made that possible. So it really kind of opened up that landscape. And so you've got, um, the thing with healthcare in terms of data is it's so fragmented in terms of there's, if you think about when you go see the doctor or when you go do anything in healthcare, there's usually different pieces and parts that aren't necessarily part of the same system. So the challenge that doctors have and their teams is how do they look at that in a comprehensive way? And you might think that that's really easy because we think about other industries like finance or wherever, and you just go to a bank and you want to transfer money somewhere, and it doesn't matter what the other bank is, it works.
Right.
It's not the case in healthcare. So with the shortages of physicians, the challenges around just getting access to data, it's just becoming more important to be able to try and get access to that data and really give that in as much of a complete picture as possible to the physician and his or her care teams, so that they can do what they need to do, when situations arise, or just to take care of folks. So it's getting harder, not easier.
Well, I mean, I'm hoping we find a way to face those challenges. And I guess in some ways, Matthew, because you have deep expertise here, I'm curious, whether this is a kind of a glass half full moment or a glass half empty moment in terms of the world of healthcare. I mean, every day I hear about breakthrough science that offers tremendous promise of the next generation of cures for a wide variety of illnesses. And then I read about some of the stuff that you've just touched on, Matthew, like the shortages in staffing, the systems that are essentially siloed, right? That they're
Yeah.
still that very fragmented data sources, the kind of privacy conversations and regulatory situations there. One of the things that drove me a little bananas over the COVID period was I relocated to the south of Florida. And my doctors in New York one day called me and said, "Listen, I can't help you anymore. Like they don't allow me to do like telemedicine, across,
Right. He wasn't
you know,
licensed in that state.
yeah." And I was just like, that is interesting, but also kind of another battle, right?
Yeah.
So, I mean, where are we? Are you excited about where we are and the opportunities forward, or do we really still have to dig ourselves out of some of these kind of ditches we've created?
I think it's a little bit of both. I mean, I think there's lots of opportunity. I mean, 20 years ago when I came into healthcare, I saw it as, gosh, it seemed like there's just so many opportunities to make better use of technology to do some of the things that you talked about. Like, why can't you be in Florida or wherever you want to be and talk to and get treated by your physician wherever they are? You think about some of the specialties like mental health, for example, in some of the areas of the country where they just don't have any mental health providers. So to be landlocked and say, hey, you can only be seen by people in this geography is a big problem. Um, so I think, I see there's a lot of things actually coming, and we're kind of on the cusp of a wave where there's been a lot of new legislation and new rules put out that are really being forcing the healthcare companies to share data in a more structured way. And so, simply put, that just means more of a standard way, and it sort of have to play more fair with one another. So, 10 years ago, it would be really hard to get information from one doctor's office to another doctor's office. And so that's why, you see one of the challenges, you pretty much go into any medical office today and you'll see technology that really became popular back in the 60s, the fax machine. The fax machine is still alive and well in healthcare, and I promise you that any medical setting you go into, they still have a working fax machine. And if you find one that doesn't, call me because I want to talk to them and see what they do. So, that's a challenge. And so I think there are some rules, there's some standards, there's some new technologies that are getting created that really help sharing that information. So I think, there's good promise for that. And you talked about security and privacy and the technologies that are out there, some people are concerned about, but relative to things like the fax machine, where something gets printed up and you have no idea who comes by and grabs it, it's actually a lot more secure than some of the existing methods that are so pervasive in doctors' offices today.
Yeah. Well, I mean, it is funny how we coexist with a wide variety of technologies from the generations. I think, a funny anecdote on the fax machine in the doctor's office. I do remember recently being in a doctor's office, filling out 10 pages of forms,
Right,
handing it over to the receptionist, she taking the forms and then putting them all on a fax machine.
right,
And I said, "What are you doing?" She said, "Oh, well, we're sending it into our data entry facility."
right.
And I said, "What do you mean?" He's like, "Well, they then now are going to put it all, because I like to keep it digitized." So I was like, "You could have had me fill it out on an app,
Right, or
or,
like an
or
iPad or something. Yeah,
like I
yeah.
was like, wow, that's amazing. It just kind of shows you all those points where there's risks for data inaccuracies in the system for sure. But also, I
Well, and
mean, tremendous opportunities, right? So,
yeah, and I think that's sort of one of the challenges I think that a lot of folks don't think about is, you'll find some really cool innovations in different systems, and they'll have things that will be like, the opposite of what you talked about. So you walk in and everything is virtual. You do get an iPad to check in. You can check in like you do at the airport in a kiosk. So you don't actually have to, have paperwork and that kind of stuff. And one of the hard things that is inherent in healthcare, and part of it, there's a lot of drivers for it, it's tough to really get scale. And
mm,
because it's partly what you said, you have a lot of silos. So just because something works, say in Seattle or something, in that ecosystem of different hospitals and doctors offices, it's going to be a dramatically different environment in Houston, where you've got the highest percentages of, small practices in the country.
Mm.
And it's just very different. So when somebody has a great idea, a lot of times those ideas don't get as much traction as, you and I maybe from the outside looking in would think. And it's because there's just so many things that prevent it from actually scaling.
So we've read a lot about this year being, 2023 being the year where the general, I'd say, professional consciousness of AI appeared. It's not that AI has really not been here. It's been here for decades. However, this year there was that moment with OpenAI appearing on the scene. Tell me, is that an area that you see impacting what you and other colleagues do in the healthcare profession?
Yeah, so in many ways. And so, and a quick example, I had the luxury of going on a cruise. So a little seasickness. So I went in to see the doctor. I'd scheduled that appointment because I wanted to get the patch for, behind your ear, right? And so the day before, my company, we were doing a demo internally of a capability that we had built where basically the technology listened to the conversation that the doctor was having with the patient. And so maybe a 10-minute conversation. So the conversation totally normal. Hey, how you doing, Brent? Like, how the kids? Oh, we just went to Disney. Very normal conversation. And in the conversation, there were some questions about, oh, it looks like you have a rash. Where'd that come from? Well, I was working in the garden, that kind of stuff. And so fast forward to the end of that conversation, as the technology was transcribing the conversation, it sent it over to the chat model that we were working with. And then it basically pruned everything that was non-clinical out of the notes and wrote it in SOAP format, which is the format that, clinicians typically use. And it was probably better documentation than I've seen in most notes I've ever seen. And
Wow.
so it was, super fast, super accurate. The physician had to review it anyway. And so I tell that story because the next day, when I went in for my appointment with a physician to get the patch for the cruise, which I was irritated at because I didn't understand why I had to drive 30 minutes to the office to get a prescription for a patch anyway,
Hmm.
a medical scribe came in and he did the same thing, arguably, that the technology did. And I asked him about, hey, have you heard about AI and what that's going to do for your role? And he hadn't. I'm like, you should probably check it out
Yeah.
because, the benefits of the AI is that the physician doesn't have to check in with him about how his weekend was or, you know, is he in a good mood today or any of that. The AI will always show up and do what's needed. And the physician has to review those notes anyway, regardless of who does it. So it's not like that step gets skipped. That's
Well,
just
I mean, I love that example. I thought you were going to say something like they gave you the patch, but also they realized they said, but Matthew, the rash that you actually had is a sign that you have to take this ointment or something like that.
no,
You
no,
know, it was
no.
like, wow, what a smart machine. But, for me, it's one of those things where we talk about all the data that kind of can feed into these systems. And I think that one of the questions I have for you, because you've lived this world, is how are we going to work through this privacy issue? I mean, when I get into conversations with people like yourself about innovation in the healthcare space, I get really excited because I can see how things could be so much better. And, I can imagine that if my doctor was able to have my data, almost always on data input from my Apple Watch, and that was fed in with all the other information that she gets quarterly, I would feel like a professional athlete, in the sense that, you'd have all this kind of monitoring going on. But then I read, oh, well, can't really take all this information. And there's a fear about what the insurance companies might do and all of these things. I mean, how are we going to manage this?
Yeah, I mean, if I had the answers for that, I probably wouldn't be talking to you. And
Yes.
I mean, part of it is just you just look at the differences around the country in terms of how different states, and it's typically handled at the state level in
Yeah.
terms of how they treat data. So some some states, for example, will say, you know, if you go into the hospital or go into a facility, it's assumed that you're going to share that information with kind of the network. So there's health information exchanges that have been kind of set up. So your labs, you know, that kind of stuff. And the idea, so it's assumed the default that you will share, and you have to explicitly say, hey, I don't want to share.
Mm,
It's reversed in other states like New York, where it's assumed that you don't want to share and you have to actually put effort into it. So, just a quick example of just the differences in terms of how people see it. So, you're right. There's a lot of things that can be done, and especially with AI and deep fakes and all these different things that you've probably seen, in terms of it's like, gosh, the more they get, the more they can pretend that they're me because they
mm,
can mimic my voice, my image, my conditions, all that stuff. Um, that being said, there's a lot that can be done with de-identified data. So, you know, you think about an example of maybe how to use information is, you know, it sounds like you've got a bit of a cold. So, you know, the physician, you know, the system can look at that and say, okay, well, based on the last, you know, number of times that this condition has been presented, and this might be a really simple example, you know, here's the next step that either you, the physician, took or other physicians took in this scenario. And here's what they did. So it could present it as, hey, would you like to do this? So not unlike your iPhone probably does, you know, when you're going somewhere in the morning, if the last 5 weeks you've gone to the same place on Monday morning, you know, somehow your phone knows that that's what you've done and it suggests a map to say, hey, do you want to go to that Starbucks? And you're like, wait a minute, that's creepy. How does it know that? And it knows that because, you know, that's what you've done the past few times. So, you know, that data doesn't have to be specific in terms of knowing where that came from to be useful. So, you know, there's a lot of different conditions where you can have de-identified data and make it really useful. Um, so, you know, but that is a major concern that people have for sure.
well, I thought you were going to say, they could tell the data, say, Mr. Breen has perhaps been at too many holiday parties over the last 2 weeks.
Well, they do,
And if he could steer clear from any more eggnog, spiked eggnog, that he would be
right.
better off.
Well, you know, you say that, and that's not far-fetched in terms of there's things that I've worked on in terms of, you know, we just call them high frequent flyers, and you'd say, you know, for it could be for drug seekers or different things in terms of going to see different ED places, you know, in the community, and you know those that could be a sign, one of many, not necessarily a guarantee that you've got an individual that's seeking for drugs, and it's to say, okay, well, rather than continuing to do that, how can we reach out and help them?
Yeah.
Um, but then there are other things in terms of outside of just the healthcare stuff, in terms of all of the different financial data and demographic data that you have. So companies like LexisNexis and people who, you know, sort of curate these data sets, um, there is a lot that they can get and sort of predictive and figure out, hey, you know, we can tell from Mr. Breen's purchasing pattern, different things. He is buying a lot of eggnog. Like, what is going on? You know?
Yeah, exactly. Well, Matthew, it's been really fun talking about all the data, but I want to get a sense, really, you said that from early on, you really wanted to enter the healthcare space. You've had a career in that space. What drives your passion for this?
Yeah, I think, you know, I'm a curious person by nature, love to learn. And, you know, one of my favorite movies is We Bought a Zoo. It's with Matt Damon. And his sort of phrase in there is you know, you got to have 20 seconds of courage. And that's sort of his mantra through the movie. You know, he'll go into any situation. He's like, all you got to have is 20 seconds of courage. So I really enjoy kind of bringing that spirit of curiosity into situations which are ambiguous, people don't have the right answers for, and really kind of working with the people around me to help them unlock the answers. And a lot of times, you know, that's really pushing through these preconceived limits. And so
Yeah.
healthcare is one of those industries that there's all kinds of research around how long it takes an idea to go from the idea is proven and works to become adopted through the system. And so, and there's all kinds of reasons for that. But I love pushing through that and kind of doing that with people. And, ultimately the benefit is hopefully that physicians and their teams can have more capacity to take care of people like you and me, because I'm not gifted in that way, but
Yeah.
I can help them do that better. So that's really what I like doing.
Yeah, I love that. It's a really great way of framing it up. Well, Matthew, here we are, 2024. What do you see on the landscape in the healthcare space?
Well, I think we've been talking about it. I mean, I think you see some studies in terms of, I think 80% or more of companies are predicting that they're going to use AI in some way. If you ask employees what they say, roughly a third of them will say that, yeah, there are parts of my job that I think could be impacted or used by AI, so it's really everywhere. So the question to me isn't really, whether or not AI is going to have an impact. It's really going to be how and where. And so I think that's where, whether it's, it doesn't matter what your role is, whether you're a product person, whether you're in finance, marketing, you're a writer. I mean, anything. It's sort of like there's going to be whole jobs are not going to be replaced by AI. So don't think about it as kind of all or nothing. Rather, there's going to be certain pieces of things that you and I do where we can use AI to be really helpful. And I would say for me, the best way that I think about it that was really kind of taught to me was, if you think about the mental effort that it takes you and I to do the first draft of something, whatever that draft is, that first draft is usually pretty hard. Once you get it, then you can revise it and sort of make edits to it and that kind of stuff. So I think where I see a lot of the promises, whether it's the example that I talked about earlier with, recording the notes of the, discussion the physician was having with the patient, or whether it's, writing something or doing some research or whatever, I think AI can really help us do that first draft and do it really quickly. So rather than spending, the mental energy on that first draft, we can then spend a little bit getting to that point and then use the rest of that energy to take it from something that's okay, it needs some work to make it really great. And so that's a way that we can use it. So it's not going to replace what we do, but it changes where we spend our mental energy on
Right.
things. That's at
Yeah.
least how I see it. And that's kind of where I think the promise is for us.
Yeah, no, I like the way you describe that because a lot of times I think people do talk about the replacement actions. Also, sometimes they'll say, well, it's, humans need to work alongside machines. But you're actually talking about kind of a shifting of the order of what you focus on, really, and putting more stress on us as humans to focus on those higher order activities and try to get something that's kind of a polished, original, creative, some of the higher order functions instead of spending 98% of the time on simply collecting the data, right?
Right.
Which is a great way of describing it.
Yeah.
Matthew, if someone wanted to reach you and talk about any of these things that you've been working on and really driving innovation in healthcare, where's the best place to reach you?
Yeah, the best place is, my LinkedIn profile is out there. So my email is matthew-taylorx@outlook.com. So, I'm out there sort of in social media. My Twitter handle is the same. So, I think probably in the show notes, we'll probably include the details on how to get a hold of you and me. But yeah, definitely available and to talk about what I'm seeing and learning in the marketplace.
Excellent. Well, Matthew, thank you so much for enlightening me, at least, on some of these key topics. Matthew, it's been amazing having you on the show. We've been speaking with Matthew Taylor. He is really a healthcare expert. He's worked through in the areas of analytics, IT, and really driving healthcare strategy. Been talking about kind of where things are, where things are going, some of the pitfalls and challenges that we still see today, and really areas that we might see some tremendous progress. So, Matthew, thanks so much for being on the Uncaged show, and we look
Yeah.
forward to having you back.
Thank you.